Hello, my name is Deb. I'm a family nurse practitioner. I've been doing this for 25 years. I started off in biochemistry, worked in a lab for a while, and so I've always been really strongly based in science. And I work my whole practice around science. But I also have always been somebody who really pays attention to patterns and can often pick up when a person's labs don't necessarily match their symptoms, don't match, just something is off. And for a long time, I did this quietly, like intuitively paying attention as to, what makes sense from all the data that I can pick up, whether it's labs, physical exam history, or just a sense that the things are not adding up. So as I've progressed in my own career, I went and did different trainings, including Reiki, that kind of helped me find how to talk about what it is that I do and how I notice things on different layers. And so as time has progressed, I've grown in this skill and to be able to pick up some of the subtle cues that don't necessarily show up on a regular exam. And so sometimes, during functional medicine visits or especially during Reiki visits, I will get intuitive guidance regarding physical, mental, emotional, and spiritual soul level things. And this is something that's grown over many years. And it's not something that I have ever used as a diagnosis. I'm never going to say, oh, I think this, yeah, I feel this, and therefore you have this diagnosis. But what I do is integrate it with what I can do as a nurse practitioner to help guide what a person needs. And what I have found is that when I combine the intuitive process with the functional med process, often I am much more able to help people find the tools they need to feel better. Because, in medicine, we tend to focus on the physical, and then the mental health is done by the psychiatrist or the therapist. But for almost everybody who stands in front of me, your health is a combination of physical, emotional, mental, and spiritual. We are whole humans, and we come in the door with whole human problems. And when functional medicine or modern medicine focuses on one or the other, we don't get the whole picture. And what I often find is that somebody needs a little more tweak on this side or this side, and intuition helps me bridge that gap to really help put the onus and the focus on the parts that are going to help the most. And Reiki and energy therapies can actually help in the areas where supplements and diet changes and lifestyle and meds can't often target. And that's the emotional, the mental, the spiritual. So combining what we can do with functional medicine with what we can do with Reiki and energy medicine hits all the buttons. So I'm now recommending that when people come in to see me, especially new patients, that you also schedule at least one Reiki session towards the beginning of care where possible, so that we can add in the energetic layer and any intuitive insight that may come up with that session, so that we can combine that with what's happening and what we're doing on the functional med side, so that we're using all the tools available to get you to your best place of healing, of feeling good, whether it's emotionally, mentally, physically, or spiritually on a soul level. If you are struggling with feeling like your symptoms are being dismissed, or your current care team hasn't really been able to hone in on what the issue is, but you still know something is not right, this combined integrative approach may really help you find that next step so that you can feel better. I know for me that Reiki and energy therapy was a huge piece of my own healing, and I want to offer that as a combined approach for all who are ready to take that next step.